Now moving on to this, each day hundreds of Americans, well, it's probably more than that at this point. We'll check the numbers with the doctor, but we're following up on the opioid epidemic. There were 1,300 opioid-related visits in just Houston in the past year. Dr. David Pearce is the Chief Medical Officer for the City of Houston, and he's here to talk a little bit more about the crisis. I may have messed that number up at the top there, Doc, but regardless, I mean, opioids, all these years later, still a major issue.
It is a major issue, and unfortunately, it's a growing major issue. So you mentioned the number of 1,350 opiate-related hospital visits in Houston last year. So 2 years before that, it was less than 800, about 795. So almost a doubling just in 2 years. So this is a growing, significant, serious problem we're facing.
Yeah, and on one hand, you kind of hear that we're getting a handle on it, but then you see the numbers and it goes against what we assume with some of the treatments and other things. And I think, Doctor, it's also important to point out opioids are not necessarily illegal on their own.
No, there are many opiate medications that we use quite effectively, and many of our pain medicines are opiate-based pain medications. And unfortunately, that's where a lot of people become addicted, is that they get a prescription from their doctor, and not only do they relieve pain, but they also can create a sense of euphoria that people tend to like. And if taken enough and quickly enough, they can actually become quite addictive. And so then people develop a craving for it and will start seeking out opiates from other sources if their doctor stops prescribing it.
And Doctor, can you tell us some of the signs that it's moved from, that typical prescription you need for whatever surgery into now a situation where there's an addiction?
Really, the biggest thing to recognize that there's an addiction is that somebody is craving it and will basically do whatever, it consumes their life, and they will do whatever it takes for them to get a hold of some medication. Now, an overdose, so if you're seeing somebody and they've overdosed, and these are important things for you to recognize, they're going to be very sleepy. They're going to have very small, tiny pupils. They may go completely unconscious. Their breathing is going to slow down and become very shallow. They may actually make a gurgling sound as they're breathing because they're not protecting their airway. They'll be very limp. And then if they start breathing slows down enough, their skin color will start changing. They'll become pale, or what would be worse if they start becoming blue. That is a true emergency. You need to call 911 and get resources moving so we can help that patient out.
And Doctor, how is the Houston Health Department addressing the epidemic at this point?
Yeah, so we're trying something which we think is pretty innovative, where when the Houston Fire Department responds to a patient for which we give the medication Narcan, which will reverse the effects of the opiate, we coordinate with the Houston Recovery Center, and they will go to the hospital we transport the patient to. We work with the emergency department staffs, and they will then interview that patient and offer them resources so that they can get into treatment and get over their addiction. And in addition, we will provide them some of their own Narcan. If there's a family member with them, we'll provide them with the Narcan, teach them how to use it so that should the patient overdose again, that there will be somebody there who can give that Narcan spray in the nose to hopefully wake them up and save their life.
And Doctor, what about these frontline workers? I mean, obviously they've had to adjust, I guess, over the years what they're expecting when they respond, because we didn't always have Narcan, for example.
No, so I was a paramedic back a long time ago, and back then only the paramedics had Narcan, and it was by injection. Today, it's in a nasal spray, and we have all of our frontline units, and this is part of the Frontlines project, but all the fire trucks have it, all the ambulances have it. In fact, the Houston Police Department, all of those street officers have got Narcan as well. And you can get a prescription for it. If you're a family member of somebody who's suffering a narcotic or an opiate addiction, you can get a prescription for it. You can go to a pharmacy, you can ask for it. There's a statewide prescription available basically to anybody if you ask for it. And it's extremely easy to give, and it's very effective.
Yeah, I mean, ultimately, we want to treat whatever the root is of addiction, but in the meantime, we just want to save people's lives, and we know that's come in quite handy. So, Doctor, thanks for the information. I hope that helps some families out there. We always appreciate you chatting with us each and every week here on our live stream.
My pleasure.
Dr. David Pearce, City of Houston. All right. Quick break here. We'll have more ahead. Don't forget, you can always go to click2houston.com/scene at 7 for more.